How does Haldol treat schizophrenia as an antipsychotic? Imagine a medication that can help calm the storm of voices and strange beliefs that some people experience with schizophrenia. That's what Haldol, or haloperidol, aims to do. It's a first-generation antipsychotic, meaning it was developed quite a while ago and has been used for many years to manage symptoms. The main way it works is by blocking dopamine D2 receptors in the brain. Dopamine is a chemical messenger that helps transmit signals between nerve cells, especially in areas linked to thinking and perception. When dopamine activity is too high, it can cause hallucinations, delusions, and other positive symptoms of schizophrenia. Haldol binds tightly to these D2 receptors, preventing dopamine from activating them. This reduces the abnormal signals that lead to psychotic symptoms. It's like putting a cap on the overactive dopamine system. Because of this action, Haldol can quickly lessen hallucinations and delusions, making it easier for people to think clearly and interact normally. It mainly targets the mesolimbic pathway in the brain, which is heavily involved in psychosis. Besides dopamine, Haldol has some effect on other receptors, like serotonin 5-HT2 and alpha-1 adrenergic receptors, but its primary job is D2 receptor blockade. This strong binding can cause side effects, especially movement disorders called extrapyramidal symptoms, which include tremors and stiffness. Interestingly, because Haldol does not strongly affect other receptors like histamine H1 or muscarinic acetylcholine receptors, it tends to cause less sedation and weight gain than some newer drugs. Over time, Haldol influences how nerve signals are transmitted in brain regions like the striatum, which may help explain why it takes some time to see full benefits. For people with schizophrenia, Haldol can be a powerful tool to control distressing symptoms like hallucinations and paranoid beliefs. But it's important to remember that it's usually used long-term and must be carefully managed to avoid side effects. Stopping it suddenly can cause a relapse because schizophrenia requires ongoing treatment. So, in essence, Haldol helps by blocking dopamine D2 receptors, calming the brain's overactive signals, and making life easier for those living with schizophrenia.